In recent months, we have worked with local leaders to counter local spikes with targeted restrictions. But this local approach has inevitably produced different sets of rules in different parts of the country that are now complex to understand and to enforce. So, just as we simplified our national rules with the rule of 6, we will now simplify and standardise our local rules by introducing a three-tiered system of local COVID alert levels in England set at medium, high and very high. The medium alert level will cover most of the country, and will consist of the current national measures. This includes the rule of 6 and the closure of hospitality at 10 p.m. The high alert level reflects the interventions in many local areas at the moment. This primarily aims to reduce household-to-household transmission by preventing all mixing between different households or support bubbles indoors. In these areas, the rule of 6 will continue to apply outdoors, where it is harder for the virus to spread, in public spaces as well as private gardens. Most areas which are already subject to local restrictions will automatically move into the high alert level. As a result of rising infection rates, Nottinghamshire, East and West Cheshire and a small area of High Peak will also move into the high alert level. The very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. In these areas, the government will set a baseline of prohibiting social mixing indoors and in private gardens and, I'm sorry to say, closing pubs and bars. Mr. Speaker, this is not how we want to live our lives, but this is the narrow path we have to tread between the social and economic trauma of a full lockdown and the massive human and indeed economic cost of an uncontained epidemic. With local and regional and national government coming together in a shared responsibility and a shared effort to deliver ever better testing and tracing, ever more efficient enforcement of the rules, and with ever improving therapies with the mountains of PPE and the ventilators that we have stockpiled, with all the lessons we have learned in the last few months, we are becoming better and better at fighting this virus. And though I must warn the House again that the weeks and months ahead will continue to be difficult and will test the mettle of this country, I have no doubt at all that together we will succeed, and I commend this statement